Welcome everyone. Thank you for joining us today. I'm Teresa Marintet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 668,181 confirmed cases of COVID-19 in Canada and 219,120 cases in Ontario. Chatham-Kent has 844 cases, and Sarnia-Lambton has reported 1,224 cases. Michigan now has 523,618 cases, with 26,964 cases being in Detroit. Today we are reporting 175 new cases of COVID-19 in Windsor and Essex County. 19 cases are related to outbreaks, 9 are close contacts of confirmed cases, 3 are community acquired, and 144 cases are still being investigated. We have had 9,990 cases since March. 7,103 cases are now resolved, and 2,661 people are active cases at this time. 99 confirmed cases are currently in the hospital, and 17 people are in ICU. We are reporting an additional 16 deaths today. 14 people are from long-term care and retirement homes. 6 women and 1 man in their 80s, 5 women and 2 men in their 90s, and 2 people are from the community, a woman in her 80s and a woman in her 90s. Our community has lost 226 people to COVID. 153 people were among residents and staff in long-term care and retirement homes. There are currently 45 active outbreaks in Windsor and Essex County. 21 are in long-term care and retirement homes, 19 workplaces, 3 community outbreaks, and 2 hospital outbreaks. Vaccination of residents, staff, and essential caregivers of our long-term care homes and retirement homes continues. Yesterday, our staff helped 2 retirement homes complete their vaccinations, and an additional 4 retirement homes completed their own vaccinations. Today, we are on site supporting vaccination of 2 retirement homes, with an additional 3 retirement homes completing vaccinations on their own. So after today, if all goes well, we will have completed 13 out of 24 retirement homes. We anticipate that these homes will be completed this time next week, pending any unforeseen issues. Despite the rollout of the vaccine, please continue to follow public health measures. Stay home if you're sick, limit your close contacts to your household members, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, wear a non-medical mask or face covering, cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze, and download the COVID Exposure Alert app at canada.ca. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us again. As we continue to see the cases in our region and continue to report COVID-related deaths, it is tough, it is hard, it's challenging, and I want to express my sympathies and condolences to the families who lost their loved ones. But in the end, we can also see the silver lining as we continue to roll out vaccines in Windsor-Essex. Yesterday, we had our second meeting with our health system partners, along with Mayor Dilkins and Warden McNamara. At the meeting, we were able to share the most up-to-date information received from the province. We discussed the preliminary population projection based on the priorities, potential timelines, and anticipated vaccine doses in the region. We also identified key deliverables and leads to work on the deliverables. We are thankful to all the partners for stepping up to support this massive vaccine rollout. I understand that there's a lot of interest in the vaccine rollout for Windsor-Essex, and we will continue to share more information as it becomes available. Thank you.
So we will now take questions from the media. We'll start with the Windsor Star.
Yes, good morning, Doctor. Good morning, Teresa. Do you have an update on when you will receive more doses of the Moderna vaccine? You say by this time next week you'll be done the retirement homes, but as we know, you don't have enough doses to do that.
So we were advised that we would probably get the vaccine early February, I think it's February 1st. And so what we are doing now is using our current stock of Moderna to continue on with the homes. And we will be starting new doses or second doses at the end of January, January 28th. So we're going to continue on, and we've been assured by the ministry that we will receive our shipment in February.
So to be clear, you're no longer holding back that second dose because you will be getting doses in time to do the second doses.
That's correct. So we were holding back until we received confirmation of from the ministry that we will be getting our next shipment.
And then separately, do you have an update on the number, or generally speaking, the number of employees of long-term care homes that are refusing the shot, that don't want it right now? Or do you have the majority consenting and being immunized?
So as you know, the vaccine is being offered for staff through the hospital Pfizer vaccine allotment, and also through us with Moderna. So we haven't reconciled those numbers to actually determine the refusal or the people that have declined. So I don't have an accurate number for that. We are picking up staff that had not been scheduled yet at Pfizer or weren't in attendance for whatever reason. So we are getting a lot of people at the homes being vaccinated, like staff being vaccinated right at the home. So when we reconcile those, which may be something the ministry will do, because we are reporting on, we report to the same database, but we're reporting different vaccines. So sorry, I don't have the accurate number.
Okay, thank you.
Any questions from AM 800?
Dr. Ahmed, later today, the Premier is set to make an announcement, more restrictions. Have you and your team been advised on what those restrictions would be? And if so, are you pleased with the restrictions?
I think if I answered the first question, the second question will be null and void. And no, I'm not aware of any of those restrictions.
Is there anything you're hoping he presents today?
Well, I think what we have heard, like many others, what else is under consideration, such as reducing the number of hours for all these businesses that are currently open, and absolutely making it essential for the workplaces to look for ways to have their workers work from home and only have the essential workers coming to workplaces. But again, these are all speculations. I haven't seen or heard anything directly from any channels from the ministry to say whether these are accurate or what is being considered at this time. But I truly hope that whatever decision or recommendation comes out, it should help us in bringing our case counts down. We have seen some drops in our case counts, which is, again, knock on wood, where maybe we're getting to the point where we would like to see to continue reduction in the caseloads, and with measures that limit or restrict the number of people coming in together in numbers, that would be a welcome sign.
When it comes to our overall cases, and just by looking at the number today, looks like tomorrow we'll be hitting 10,000. Just your thoughts on that. I know we asked you when we hit 1,000, 2,000, just your feelings, but 10,000 just seems like, I'm not even sure what word to use here, just a very high number.
No, absolutely, and I think it's unfortunate that we are getting into that situation. It's unfortunate that we have crossed the 200 mark a couple of days ago with our deaths in the long-term care home. And it really is concerning for the community. And I still worry about the messages sometimes people are putting forward when they are not taking this disease seriously. This is a disease that is killing people. This is a disease that are affecting many, many lives. This is the disease that's causing all these this chaos in the world. And it's not just, we are not unique. It's causing chaos in the entire world at this time, and we need to take it seriously. We recognize that there are challenges. Many of these measures are not so easy to implement by many, but we have to do it. I get it. People are tired. People have been doing that, and especially the ones that are following every measures right from the beginning up to this point. And it's frustrating for them to even see when people, after 10, 11 months in pandemic, they still don't follow that. So I think it's, I truly hope that people look at those numbers carefully and understand the implications and how it's impacting our society, and take appropriate measures, do their part in helping us to contain it.
Thank you.
Any questions from CTV?
Yes, good morning. I guess in addition to the additional measures, restrictions, do you also think an extension of the lockdown is necessary, or would you welcome that?
Well, I think we'll have to go back to what our local situation looks like. I think, again, for Windsor-Essex, I don't think that the numbers are there to justify that we should remove the lockdown measures, but we also know that our community is not isolated. There are people who move from one community to another. So an overall provincial approach is always helpful, but we also recognize that not everyone in this is in the same position. And when the time comes to review some of those measures, I'm sure that the respective authorities will take all of those factors into consideration before they make a decision.
Okay, thank you.
Any questions from CBC?
Yes, hello, good morning. Thanks for taking our questions today. I also wanted to ask about the public health measures that are coming from the province today. There was talk of a possible curfew, but it seems like they've kind of backed away from that idea. Do you think that a curfew would be effective in this case?
Well, it's hard to say at this time that whether it would be effective, because I think we haven't seen many evidence in terms of the benefits of these curfews. I think as an overall strategy, when we are talking about how we can reduce the number of people coming together, I think we'll have to look about that. But then on the flip side, that what are we trying to achieve, and how it will impact the broader community, I don't think that there's lots of evidence to say that this would be a measure that would bring more public health benefit. So I can't really comment based on the lack of evidence on that.
Okay. We've seen some cell phone mobility data showing people in Windsor as well as in the broader region out and about ahead of Christmas time and the planned shutdown on Boxing Day. If new restrictions were announced today, do you think that they should take effect immediately to avoid any kind of rush?
Well, I think it's always a tough balance in terms of giving an opportunity for the community to be ready for what is to come, and especially when we are talking about any measure that would impact someone's ability to get the necessities of life, such as like groceries, medicine, and whatnot. So those are the critical pieces, and it may not be as easy for anyone to just say, hey, go and get it all done for the next 10 days or 14 days or what so many days and put it in place. So it may not be that easy and simple. But I think for some of the other stuff, it helps because it takes effect immediately, and the longer time you give, it allows people to go for that mad rush and to get all those things done in a short time period, which brings many people together. So I think we just have to find the right balance, that what is the appropriate balance and what type of measure should be implemented immediately versus what measures can be deferred for a day or two to get the people ready to have all of those provisions in place.
Any questions from Blackburn?
Yes, good morning. I'm just wondering if the nursing staff are noticing people having fewer contacts. I know that was a big concern at one point. Numbers are still growing, but now that we've kind of passed the Christmas and holidays, are you noticing fewer close contacts, having to make fewer calls?
We are not noticing that at this time. We continue to have the, similar numbers of contacts, and usually it is, household close contacts continue to be, our primary source of contacts. So, but not yet. I think that, even though our numbers are down a little bit, it might not necessarily have translated into a reduction in the number of contacts at this time. So I think the coming days will determine that.
Thank you.
Any additional questions from the Windsor Star?
No, thank you.
Any additional questions from AIM 800?
Dr. Ahmed, just a quick one here regarding the vaccine rollout. We have a question from a listener, asked if we can ask you. A person with a compromised immune system, when in the list will they be given the vaccine?
A great question. I think people living in the community, they can come into different categories. So one could be an adults receiving chronic home care, so they could fall under that category, or the other category would be the high-risk priority population based on their medical needs. And we anticipate that once we complete the long-term care home, retirement home residents and staff and their caregivers, the next item is the healthcare worker prioritization. And then along with the healthcare worker prioritization, because that's a significant group, when we start to get into more vaccine supply, and then we start to touch on all these congregate care settings, all their residents, the adults receiving chronic care, including some of the priority population from various segments. And so I anticipate that, again, we are seeing something like that in March and April. Things change if we get a bulk supply of vaccine, or if we get some assurance from the province that we are getting more vaccine, we can put all of those things in priority. But it is all dependent on the availability of the vaccine at this time.
Thank you.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
Yes, I do have one. It's about vaccination efforts in long-term care and retirement homes. Is there an estimate for how many residents still need to be vaccinated?
So I'll start, and then maybe I'll pass it on to Teresa. So when we are going into all of these long-term care homes, everyone by definition is eligible to receive the vaccine, unless they are positive for COVID and they are not discharged from the care, or if they are exhibiting symptoms of COVID, or if they didn't consent to us. So anyone else who is not in these categories, sorry, I forgot to add another category, is anyone who is acutely symptomatic for any other disease or any other infection, which puts them in a difficult position to receive the vaccine. So all of those people are eligible. And then you may have someone who would either do not consent to vaccine, or if their healthcare provider has said you should wait for the vaccine. Those are the categories that you would expect that would not receive the vaccine. Based on the numbers that we have, I think we are touching pretty much close to 80 to 90% of the resident for most of the homes. But I'll let Teresa add more information.
No, I would just agree with that we're seeing, many residents are accepting the vaccine. We don't hear of too many refusals at this point, other than the fact that they're waiting for, permission to receive the vaccine based on an illness. And we are circling back with the homes and trying to get as close to 100% compliance, not compliance, but coverage, I guess, is the word. And we're seeing, people are getting vaccinated, the residents.
And just as a follow-up to that, is there a procedure in place for when new residents might be moving into these homes? Like, do they get vaccinated right away, or how does that work?
So right now we are dealing with that because there is not a process in place, and we're trying to work through that. Because the vaccine, as we've talked about before, it's a real cold chain a requirement with this vaccine. So we've been delivering it to the homes. And once a vial is enough for 10 doses. So once the vial is punctured, it has to be used within 6 hours. So it's not a matter of, one person is admitted or, has, received by the home that they would immediately get their vaccination. So we will work on a process and, try to work through some of those things. But that right now, we don't want to have any vaccine wastage. So we need to make sure we're monitoring the vaccine. And if they have 10 people that need to be immunized, that is more achievable at this time. So if that includes a new returning resident or someone like that, then that would work. So every home, we're trying to support every home, but we are getting those questions.
Thank you.
Any additional questions from Blackburn?
No, thank you.
Okay, thank you, everyone.